My name is Oliver Brown, an orthopaedic registrar at Croydon Hospital. Welcome to this video on proximal humerus fractures. This is the name for a fracture of the shoulder, or more specifically, of the top of the arm bone called the humerus. This fracture can often be treated without surgery, as the bone ends are brought into the right position by the weight of the arm. This is why you'll initially be put into a collar and cuff, or a polysling, to hold the fracture in the perfect position for healing. This fracture takes a few weeks to heal, but the pain will improve after the first couple of weeks when the fracture becomes sticky. This means that the bones aren't moving around as much when you move, so you can start to do some exercises to strengthen the muscles and help with bony healing.
Hi, my name's Matthew and I'm the lead physiotherapist for trauma and orthopaedics at Croydon University Hospital. Today I'm here to talk to you about the early stages of rehabilitation following your proximal humerus fracture. As your fracture begins to heal, it is important to maintain the range of movement in the joints above and below the fracture site, such as the neck, elbow, wrist and fingers, and to begin to restore movement in the shoulder itself, but in an incremented fashion. To make this as straightforward as possible, we will divide your rehabilitation into 4 separate phases. Stage 1, 0 to 3 weeks. At this initial stage, your arm will be immobilised in a sling in order to protect the fracture. These are the exercises to give you the best possible recovery following your injury. Active range of movement of your neck, scapular retraction, elbow extension, wrist circumduction, finger flexion and extension, thumb opposition. It's important to maintain underarm hygiene, and we would recommend resting your injured arm on a stable surface whilst cleaning underneath your arm. Stage 2, 3 to 6 weeks. At this stage, you'll likely have had a follow-up consultation with your orthopaedic surgeon, which may include an X-ray and examination of your shoulder. You may be advised to continue wearing your sling, and if your surgeon is happy, you can progress to stage 2 of your exercises. Pendular exercises. Make sure that your uninjured arm is doing the lifting. Active assisted shoulder flexion to shoulder height. Active assisted abduction to shoulder height. Active assisted external rotation. To complete these exercises, you may use a broom handle or a mop. Stage 3, 6 to 8 weeks. By this stage, once an acceptable range of movement has been achieved in your shoulder, you are able to progress to lifting your shoulder without using your uninjured arm for assistance. This includes lifting your shoulder above your head. You may also start completing light activities such as domestic chores. At this stage, you might want to consider discarding your sling. Active flexion above shoulder height, active abduction above shoulder height, active external rotation, and towel slides using circular motion. Stage 4, 8 to 12 weeks. By this stage, it will be safe to start weight bearing through your injured arm. This will include pushing to get up from a chair and opening doors. You should be working towards restoring full range of movement throughout your shoulder. Tabletop push-up, TheraBand rotator cuff activation, TheraBand spider wall crawl. Aim to do between 10 to 25 repetitions of each exercise 3 times a day. We'd like to thank you for watching the video and we hope you find it useful. Thank you.